is Pia Coloracolas from Davao Doctors College, and for today I'm going to perform an immediate newborn care return demonstration. So, an immediate newborn care refers to the important actions taken right after a baby is born to ensure their health and well-being. Prior to the conduct of the procedure, I have performed hand washing. This is done to deter the spread of microorganisms. I also prepared the necessary materials. This is done to ensure that all necessary items are readily available for a safe and efficient care process. So I have prepared here all the necessary equipments in my left side. So now, properly identify the infant through the name band or rest tag. This is done to ensure that we are giving the newborn care to the right infant. Okay, so the infant's name is Angela Wong. Next, enhance infant's comfort by keeping the environment warm. This helps regulate the baby's body temperature, preventing harm from getting too cold while ensuring their comfort as they transition to the outside world. So I have closed the door, closed the curtain, and adjust the room temperature to make the infant feel warm. Next thing to do is wash hands before putting on working gloves. This is to minimize the risk of transmitting germs to the baby. But since I already performed hand washing earlier, I'll just apply alcohol. Then I'm going to weigh the newborn correctly to monitor the baby's growth and track health progress. And as you can see, I already have put the clamp, and I am now going to deduct the weight of the clamp to the total weight of the baby since it will be counted. I also have here the weighing scale. So now I'm just going to put the baby, so assist the head of the baby to make them safe. Okay, deduct the measure of the clamp. Okay, so the weight of the baby is 3.2 kilogram. So I'm just going to document it. Now I'm going to proceed to the cord dressing, but in doing that, I'm just going to set aside the weighing scale and remove the working glove. Okay, so I'm just going to put the necessary equipment that I'm going to use. I'm going to put on the sterile gloves. Now, properly restrain upper and lower extremities on the newborn to make the infant comfortable. Now, using OS gouge with ROH or alcohol, disinfect the cord 3 times from bases upward. So I'm just going to clean the cord of the infant from base to the upward. Next thing I'm going to do is to place a sterile OS at the base of the cord and clamp the cord with umbilical clip 1/2 inch from the base of the cord. Okay, 1/2 inch from the base of the cord. Now I'm done clipping it. So I'm going to cut the cord about 0.5 centimeter above the cord clip and express the remaining blood from the cord after. Okay, put it on the kidney basin. So cleaning the tip of the cord helps to get the bleeding in the infant's cutted cord. Discard. Okay, next thing I'm going to do is to place OS at the base of the cord stump and pour 70% alcohol. This is done so that the cord will be properly cleansed. Okay. Now I'm going to set aside the equipments that I've used. I'm going to proceed to the vitamin K injection. So here's my equipments. Now I'm going to withdraw the exact amount of vitamin K from the ampule and inject it to the middle, third lateral aspect of the infant's thigh. I'm going to expose the middle third lateral aspect of the infant. Okay. Okay, so I'm going to dispose the used syringe. Now I'm going to carefully get the anthropometric measure of the newborn, starting from the head circumference, chest, abdomen, and the newborn's length using the measured tape. Measuring tape, rather. Okay, so in getting the head circumference, assess the head of the baby to ensure its safety. Okay. After that, we have to document the circumference. So the head of the baby is 36 centimeter. Documentation is done so that we will remember the things that we've taken during the assessment. Okay, so I'm just going to lift the baby so that I can get the circumference of the infant's chest, circumference, and abdomen. Okay, for a while. Okay, so the chest is 39 centimeter. The abdomen is 41 centimeter. Okay, so next is the length of the baby. The length of the baby is 51 centimeter. Next I'm going to take is the newborn's temperature rectally. Slightly insert the tip of the thermometer on the patient's rectal area. Okay, so the infant's temperature is 36.5 Celsius. Next I'm going to do is to do the initial bathing of my patient. So just going to move my infant patient here, then put the basin. So in doing that, I'm going to use a working glove. In doing this, we have to hold the newborn in a football grip manner, holding both ears. Okay? So carefully wash the newborn's head with the use of baby soap and or mild shampoo. And after that, we have to dry the head thereafter. So we must remember that we have to do the initial bath 24 hours after the delivery of the mother. This is according to the World Health Organization. So next thing I'm going to do is to dry the baby. Okay, so now I'm done. I'm going to proceed to the putting on the newborn's diaper, shirt, mittens, and booties. So first, I'm just going to set aside this equipment and going to get the working glove. Put this in the proper receptacle, and I'm going to put it here. So I'm just going to use this to wrap my baby. But first, I'm just going to put the diaper on the baby. Then after that, I'm going to put the dress of the baby. Just going to put the panties of the baby. Going to put the socks of the baby. And then I'm going to put the bonnet on the baby. Okay. Now I'm going to wrap the baby on a clean and dry blanket. Okay. Now I'm going to set this aside. Then I'm going to place the newborn in the crib with drop light on and attaches the crib top. So for a while, I'm just going to put the crib. So since we're not in the hospital setting, we'll just put as is crib here. Okay, so I'm going to turn on the drop light. Okay, and I'm going to attach the crib top. So as you can see here, here's the baby Angela, and I'm going to put her to the crib. Place this one here for comfortability of the infant. Now I'm going to proceed for the application of the Prince prophylaxis. So I'm going to shade the newborn's eye from light and open one eye at a time by exerting gentle pressure on the lower and upper lids. Okay, so make sure to not, make sure to apply ointment from inner to the outer canthus to make sure that the rib of the medicine tube will not touch the eye of the newborn to prevent the risk of eye infection. Okay, so avoid touching the tip of the tube on the eye. Other side. Okay. For the next step, I'm going to take the newborn's vital sign to assess the baby's overall health and well-being. I'm just going to get my stethoscope and get the newborn's vital signs. So read it for a full minute. Okay, so I'm going to document it. So the baby has 128 beats per minute and 44 breaths per minute. Now I'm going to do the aftercare of the equipments that I used to ensure comfort and well-being of the newborn. So by adjusting the procedure, performing and minimizing the risk of complications. Okay. Next, I'm going to do is to record the procedure done and other pertinent data. This is done because some doctors needed it. So then after that, we have to answer the related questions of the procedure. After that, we have to do the hand washing because hand washing does not replace hand hygiene, and so we must perform hand washing before and after any procedure. So I'm just going to get the sterile gloves and discard it. And that is all for my immediate newborn care return demonstration. Thank you so much for watching, and I hope that you like my video. So God bless us always.